scalpel.
Here, doctor.
Retractor, quickly now, we're losing him.
January 17th, 1945. A small field hospital on the outskirts of Aachen, Germany. The air is sharp with winter cold, carrying the scent of antiseptic, sweat, and fear. Wooden stretchers line narrow corridors, each bearing soldiers whose bodies tell stories of shattered limbs and bloodied uniforms. The soft clatter of surgical instruments echoes from a dimly lit operating room. German nurses, pale and trembling, stand in the doorway. Their uniforms are stiff with dirt, their hands unsteady. Across the room, American doctors move with controlled urgency, voices clipped and precise, issuing commands in a language the nurses only partially understand. The metallic ring of scalpels and saws punctuates the tense silence. A wounded infantryman groans beneath the harsh light. One American surgeon glances at the German nurses, nodding. "Assist," he orders. Fear flickers across their faces. These women, trained to tend and comfort, now confront the raw, uncompromising reality of battlefield surgery. Every cut, every clamp, every heartbeat is amplified in their minds. The nurses step forward, hands shaking, hearts hammering, as the room tightens around the scent of blood and antiseptic. The war they thought they understood just became profoundly personal. The moment will test skill, courage, and humanity, and it will leave its mark long after the war ends. By late 1944, the war in Europe had entered its final, brutal months. Allied forces were pressing deep into German territory, pushing through the Rhineland and across shattered towns where rubble replaced streets and smoke hung low over ruined villages. The German army, once disciplined and formidable, was fraying under relentless pressure. Supply lines were strained, morale was collapsing, and medical services struggled to keep pace with the mounting casualties. In this environment, field hospitals became islands of urgency and improvisation. Makeshift wards were erected in schools, churches, and bombed-out factories. Electricity was inconsistent, running water scarce, and medical supplies were rationed to near impossibility. Doctors and nurses worked around the clock, moving from one bloodied cot to the next, often without pause. The wounded were soldiers, civilians, and increasingly prisoners of war, men and women from both sides caught in the widening net of conflict. American Medical Corps units had perfected battlefield efficiency over years of combat. Mobile surgical teams, known as MASH units decades later, had their roots here. Tents and converted buildings were stocked with sterilized instruments, anesthesia, and surgical lighting, enabling operations that only decades before would have been impossible on the front lines. Yet even with advanced equipment, the sheer scale of casualties tested the limits of human endurance. The German medical system, by contrast, was a mixture of military discipline and rigid hierarchy. German nurses were highly trained, steeped in both professional skill and a strict sense of obedience. Many had served in the Wehrmacht or Auxiliary Medical Corps for years. Their training emphasized order, precision, and emotional restraint, qualities that made them effective in tending the wounded, but also left them unprepared for the improvisation and brutal immediacy of frontline surgery conducted by foreign forces. Hospitals themselves were microcosms of a larger war. Corridors smelled of antiseptic, urine, and disinfectant. Faint cries of pain rose and fell with the rhythm of life and death. Nurses moved swiftly, guided by procedure rather than emotion, attending to fractured bones, infection, and the occasional surgical emergency that demanded instant decision-making. Every day, they witnessed trauma on a scale that civilians could scarcely imagine. By early 1945, large numbers of German medical personnel, particularly nurses, found themselves interacting directly with Allied forces. Many had been captured or were compelled to continue their work under supervision. It was in this context that American doctors began to involve German nurses in actual surgical procedures. For the nurses, it was not just a professional challenge. It was a confrontation with fear, cultural dissonance, and the moral weight of assisting in operations on enemy soldiers. The collision of cultures and medical practices would have profound consequences. American doctors operated with speed and decisiveness, sometimes disregarding the careful, procedural habits that German nurses had learned. Sterility, while rigorous, was combined with a pragmatism designed to save lives above all else. German nurses, trained to follow orders and maintain emotional distance, were suddenly thrust into situations that demanded both initiative and courage, and the stakes could not have been higher. As the war crept closer to its end, hospitals like the one in Aachen became stages where the personal and the historical collided. Every incision, every anesthetic administered, every decision in the operating theater was a moment in which history, skill, and human psychology intersected. For German nurses, the lessons learned in those freezing, blood-soaked corridors would linger long after the guns fell silent. The stage was set. Across Europe, armies were collapsing, cities lay in ruins, and medical personnel from opposing sides faced each other in unprecedented intimacy. What the nurses would experience in these operating rooms would not just test their professional skill, it would challenge their very sense of identity and humanity. German nursing corps during World War II were organized, disciplined, and steeped in a strong sense of duty. Many nurses had trained for years at military hospitals, receiving instruction not only in medicine, but in the strict hierarchy and etiquette of the German military system. Obedience was paramount. Questioning orders was rare, and emotional restraint was considered a virtue. A nurse's role was defined as both caregiver and enforcer of order within the wards, a dual responsibility that demanded precision and composure. By contrast, American medical personnel emphasized adaptability and rapid response. The U.S. Army Medical Corps had developed advanced protocols for battlefield triage, anesthesia, and emergency surgery. Surgeons often operated under conditions that would have been considered extreme by traditional standards. Makeshift operating tables, fluctuating temperatures, limited lighting, and the constant pressure of incoming casualties. Efficiency and life-saving innovation were prioritized above hierarchy. The first encounters between German nurses and American medical teams were tense. In many cases, nurses were captured during retreats or surrenders in order to assist with treatment. For them, the experience was disorienting. The language barrier compounded stress, forcing reliance on gestures and fragmented communication. Beyond the technical challenge, there was an emotional and moral dimension. German nurses were now aiding the enemy in treating their own compatriots and Allied soldiers. The psychological strain was immense, sometimes manifesting as trembling hands, pallid faces, or near panic at the sight of active surgery. Operating rooms in these American-run field hospitals were organized with meticulous efficiency. Instruments were laid out with strict order. Sterilization procedures were rigorous, often stricter than German standards. Nurses were trained to anticipate the surgeon's needs, handing instruments, monitoring anesthesia, and managing bleeding. For the German nurses, the immediacy of the work was both terrifying and instructive. They were forced to confront not only the technical realities of modern surgery, but also the human fragility of life under wartime conditions. Medical ethics became another layer of complexity. American doctors often operated with urgency that sometimes violated traditional procedure, focusing on speed and survival over formality. Nurses, accustomed to regimented routines and clear hierarchies, were suddenly required to improvise, make rapid judgments, and assist in life-or-death decisions without prior experience in such autonomy. Their initial fear gradually mingled with awe at the professionalism and decisiveness of the American surgeons. The interaction between German nurses and Allied doctors was also historically significant in the broader context of post-war medical practices. These forced collaborations allowed for a transfer of techniques, knowledge, and procedural philosophies that would influence European nursing and hospital care in the decades to come. German nurses witnessed advanced anesthesia methods, surgical precision, and emergency protocols that were rare in their own war-torn hospitals. Though terrifying, these experiences laid the foundation for a subtle evolution in post-war medical standards. At the same time, hospitals became microcosms of reconciliation and tension. Nurses learned to navigate their own prejudices, fear, and guilt while working alongside those who had been their country's enemies. In some cases, the collaboration forged grudging respect. In others, it intensified internal conflict. The contrast of medical cultures, rigid German discipline versus improvisational American pragmatism, created a unique and intense environment. Every operation, every patient, and every nurse's hand became part of the story of survival, adaptation, and moral reckoning. As the German front crumbled and Allied forces advanced, the demand for skilled hands in operating theaters increased. German nurses were no longer observers. They were participants, sometimes essential participants, in the treatment of wounded soldiers. The stakes were high. Mistakes could mean death. Hesitation could cost lives, and courage was measured not in battlefield heroics, but in steady hands under unrelenting pressure. From the outside, these hospitals were just another element of a vast, chaotic war. But inside, they were crucibles of fear, skill, and ethical confrontation. The German nurses who stepped into these operating rooms faced a world where the rules of their training were challenged by the immediacy of survival and the unfamiliar authority of foreign doctors. And in that tension, the collision of experience, culture, and humanity. The stage was set for moments of profound intensity that would leave indelible marks on both sides of the conflict. The German nurses who found themselves assisting in American field hospitals faced a torrent of emotions. Fear was immediate and visceral. Many had never witnessed surgery in real time, let alone perform tasks under the urgent supervision of foreign doctors. The smell of antiseptic mixed with blood, the steady hum of medical equipment, and the groans of wounded soldiers created a sensory assault. Hands shook as scalpels were passed, and hearts raced with each life-or-death decision. Guilt layered over fear. These nurses were tending to enemy soldiers while many German soldiers lay untreated or dying nearby. Their professional instinct to heal collided with the ideological and nationalistic indoctrination they had absorbed over years of service. Some later recalled feeling as though each surgical incision carried a personal weight, a test of loyalty and morality that left deep psychological scars. The experience forced them to confront their humanity. Amid the chaos, moments of quiet triumph occurred. A successfully sutured wound, a patient stabilized, a colleague reassured. Yet even these small victories were shadowed by the constant tension. The line between life and death was thin, and every decision could have irrevocable consequences. Field hospitals in late 1944 and early 1945 were logistical marvels constrained by harsh realities. Every inch of space was used for beds, instruments, or storage. Movement had to be precise. A dropped instrument or delayed anesthesia could mean catastrophe. American surgeons relied on efficiency, timing, and coordination, a stark contrast to the more hierarchical, measured pace German nurses were accustomed to. Integrating German nurses into this system created tactical challenges. Language barriers slowed communication. Training differences required rapid, on-the-job instruction. Yet, the need for hands was urgent. Nurses were often assigned roles beyond their comfort zones, monitoring vital signs, administering anesthesia, or managing surgical tools under extreme pressure. In these conditions, the hospital became a battlefield of its own, not of bullets, but of precision, timing, and decision-making. Every successful operation reinforced the value of the collaboration, but failures or near misses left an immediate imprint. The tactical necessity of using every available pair of hands collided with the psychological strain of German nurses confronting unfamiliar procedures under life and death stakes. One of the most striking differences for German nurses was the technological disparity. American field hospitals were equipped with sterilization units, surgical lights, and instruments that German facilities, often decimated by war, could scarcely provide. Anesthesia machines, portable suction devices, and advanced suturing tools were deployed with precision, enabling surgeries that saved lives in minutes rather than hours. For German nurses, this was simultaneously awe-inspiring and terrifying. Familiar methods, manual sterilization, simpler instruments, slower procedures, were suddenly outdated in the face of high-efficiency American techniques. Learning to handle unfamiliar tools under pressure demanded not only skill, but rapid adaptation. A misplaced instrument or hesitation could disrupt the operation, potentially endangering the patient and the nurse herself. The technological difference underscored a deeper cultural gap. Whereas German medical training emphasized procedure and protocol, the American approach prioritized improvisation and adaptability. This forced German nurses to step outside their comfort zone, reconciling their own methodical habits with the urgency of battlefield medicine. The friction between tradition and innovation created both tension and extraordinary learning opportunities. The human, tactical, and technological dimensions intertwined to create a uniquely intense environment. Fear and moral conflict collided with operational pressure and unfamiliar equipment, setting the stage for the nurse's ultimate test, participating actively in surgeries where every second, every decision, and every hand mattered. The dynamic between American doctors and German nurses was unlike any prior military hierarchy the nurses had experienced. Here, authority was immediate, pragmatic, and absolute, but tempered with instruction. Surgeons issued commands clearly and decisively. Clamp here, monitor the blood pressure, hand me the scalpel. Compliance was non-negotiable, yet the tone was often clinical rather than punitive. This leadership style contrasted sharply with the strict, formalized command structures familiar to German nurses. In their training, orders were often issued with ceremonial weight, and deviation could be harshly criticized. In the American field hospital, the need for rapid decision-making meant improvisation was valued over rigid procedure. Nurses had to learn to trust the surgeon's judgment instantly, even when the techniques and instruments were unfamiliar. For many, this experience revealed a new dimension of leadership, calm decisiveness under extreme pressure. The surgeon's ability to maintain control while instilling confidence in reluctant assistants became a crucial factor in patient survival. In those tense operating rooms, leadership was less about rank and more about competence, presence, and trust. At first, tension was palpable. German nurses were assisting in surgeries on soldiers who might have once been their comrades' enemies. Some nurses initially hesitated, their hands trembling, eyes darting toward the American staff for guidance. The Americans, in turn, had to navigate skepticism, fear, and occasionally resentment. Yet these moments of tension also became opportunities for mutual understanding. Nurses observed the professionalism of their erstwhile opponents. Soldiers who had been the enemy in battle were now patients, and the shared urgency of life-saving work created a fragile, temporary truce. Gradually, professional respect replaced suspicion, though fear and cultural difference never fully disappeared. The hospital, in this sense, became a microcosm of the war's moral ambiguity. Lines between friend and foe blurred as necessity demanded cooperation. German nurses who had been conditioned to view Americans as adversaries were confronted with the complexity of human behavior. The enemy could heal, teach, and lead with the same commitment they had once reserved for their own side. Perhaps the most profound challenge for German nurses was moral. Assisting in surgery on enemy soldiers forced a confrontation with ethical questions. Could they reconcile their duty to care with the reality that they were aiding those who fought against their country? Did fear justify hesitation, or was it a failure of professional responsibility? Some nurses struggled with the immediacy of trauma, the sight of blood, and the knowledge that mistakes could result in death. Others found purpose and courage in the act of care itself. Across accounts, the moral weight was undeniable. This was a confrontation with the human cost of war, magnified in the stark fluorescent light of operating theaters. American doctors were aware of these pressures and often offered guidance, reassurance, and a measure of autonomy, turning what could have been a purely coercive environment into one of reluctant collaboration. Yet the ethical tension remained, an invisible current running through every incision, every hand gesture, every decision. The human, tactical, technological, leadership, enemy, and moral dimensions intersected to create a crucible unlike any other. Fear, adaptation, authority, and ethical challenge combined in a high-pressure environment where every choice could mean life or death. It was in this context that the nurse's ultimate test would come. The first real surgeries under full American supervision, moments that would define the climax of their wartime experience. February 3rd, 1945. Aachen, Germany. The field hospital was alive with a tense energy, the kind that preceded a storm. Outside, winter wind howled through shattered windows. Inside, the hum of anesthesia machines and the metallic clang of instruments filled the narrow operating theater. German nurses, previously observers or assistants in minor tasks, were now positioned at the edge of the surgical tables. Today, American doctors would entrust them with real responsibility. A young infantryman, his uniform caked in mud and blood, lay under the harsh glare of the surgical lamps. One American surgeon, a captain with years of frontline experience, surveyed the room. He turned to the nurses, his voice steady but commanding. Monitor vitals. Hand instruments. Assist where instructed. Lives depend on your hands as much as mine. The room seemed to shrink under the weight of the statement. The first incision was made. The smell of antiseptic and iron mingled sharply. The nurses' hands trembled, and their breaths came shallow, almost imperceptible. Instruments were passed, clamps applied, sutures tied, all under the watchful eyes of the surgeons. Every motion was critical. Hesitation could cost a life. Time dilated. Minutes felt like hours. The operating room became a theater of hyperfocus. The American team worked with precision, issuing commands in clipped tones. The German nurses, trained for obedience but untested in improvisational urgency, adapted rapidly. A nurse steadied a retractor, another adjusted anesthesia, a third monitored blood loss. Each action was small, yet monumental. Outside the immediate surgical area, the rest of the field hospital was in controlled chaos. Other patients groaned, stretchers creaked under shifting weight, and medics moved swiftly to respond to emergencies. Yet within the operating room, a fragile bubble of intense concentration held the team together. The first operation concluded successfully. The patient's vital signs stabilized. A collective exhale filled the room, though the tension did not fully dissipate. The nurses' hands were bloody, their faces pale, but their eyes reflected a mixture of shock, relief, and emerging confidence. For many, it was the first time they had directly influenced the course of a life under such conditions. Even as the team prepared for the next patient, the psychological impact was evident. Some nurses wept silently at the intensity, while others steeled themselves for the next challenge. The transformation was subtle yet profound. Fear began to coexist with competence, hesitation with decisive action. They were no longer merely observers in a foreign operating theater. They were participants, essential to the life-saving process. These moments were punctuated by small, intense victories. A clamp applied at precisely the right moment prevented hemorrhage. A steady hand ensured a suture held under pressure. Each success reinforced trust in the surgeons, trust in themselves, trust in their ability to act under pressure. The ethical and emotional tension remained. Nurses treated soldiers they once considered the enemy. Each movement, each decision carried moral weight. Yet necessity demanded action. The juxtaposition of human vulnerability and surgical precision became a defining feature of these days. For the German nurses, the lessons learned in those operating rooms would echo far beyond the immediate crisis, shaping both their professional identity and their understanding of human resilience under extreme circumstances. By mid-February 1945, the field hospital in Aachen had become a continuous theater of life and death operations. German nurses, once hesitant and terrified, were now essential cogs in the medical machinery. The Americans had trained them quickly, and each day brought a new intensity. Casualties arrived in waves, soldiers with shattered limbs, gunshot wounds, and infections that demanded immediate intervention. One afternoon, a young American private was rushed in with a compound fracture and heavy blood loss. The surgeons barked instructions, and the nurses moved with controlled urgency. One German nurse, hands still shaking from the morning's procedures, applied a tourniquet while another prepared instruments for the operating surgeon. Every second mattered. The patient's pulse was weak, a reminder that any misstep could be fatal. The scene was raw and unrelenting. The smell of disinfectant mingled with iron. Monitors beeped erratically, and the low murmur of anesthetic machines underscored the rhythm of life and death. Nurses repeated commands silently to themselves, grounding themselves in technique. Fear persisted, but it was tempered by growing competence and a rigid focus on procedure. Outside the operating room, the broader hospital workflow mirrored the intensity within. Medics carried stretchers through narrow corridors, while other nurses managed wards full of wounded soldiers. The American command structure demanded efficiency, and German nurses were quickly absorbed into the system. Their roles expanded. Some monitored anesthesia, others managed transfusions, and a few performed minor procedures under supervision. The most intense moments came during surgeries with multiple casualties. Nurses coordinated in near silence. Instruments passed in a seamless rhythm. The surgeon's calm authority contrasted with the chaos around them, instilling a strange sense of order. Amidst the fear, a remarkable adaptation occurred. German nurses began to anticipate needs, acting before instructions were given, a testament to their resilience and training. Yet the psychological toll was undeniable. Some nurses fainted from exhaustion or the sheer shock of what they were witnessing. Others experienced guilt and inner conflict. The enemy was being saved, lives preserved that might have been considered adversaries. American doctors acknowledged this tension, offering guidance and reassurance. But the responsibility remained squarely on the nurses' shoulders. In one operation that became emblematic of the hospital's atmosphere, A critically wounded German soldier was brought in alongside 2 American soldiers. Nurses, now operating with a blend of fear and focus, assisted in triaging, stabilizing, and preparing all 3 for surgery. Each decision was crucial. Errors could mean death for any patient, yet the nurses executed with precision. That day, all 3 survived, a rare and small triumph amid the endless casualties. These surgical episodes were not isolated. They repeated day after day. The cumulative effect was transformative. German nurses who had arrived timid and terrified emerged with hardened skill and a newfound understanding of battlefield medicine. Their fear remained, but it was now intertwined with respect for the surgeons, for their own abilities, and for the profound responsibility of life-saving care. By the end of February, the operating rooms had become arenas of survival, learning, and moral confrontation. The intensity, the terror, and the ethical ambiguity fused into a crucible of experience. These moments would define not only the nurses' wartime service, but also the legacy of Allied medical practice. A forced collaboration under fire, where professionalism, courage, and humanity were tested to their absolute limits. The aftermath of these experiences would ripple beyond the hospital walls, influencing post-war medical training, ethical frameworks, and the personal lives of those who had faced the raw edge of war up close. By March 1945, as Allied forces advanced deeper into Germany, the field hospitals were quieter in comparison to the relentless pace of February, but the impact of previous months lingered. German nurses who had assisted in surgery carried a mix of relief, exhaustion, and a haunting awareness of what they had endured. Their hands bore the physical memory of countless procedures. Their minds held the indelible imprint of blood, urgency, and moral complexity. Reports from the American Medical Corps noted the surprising effectiveness of the German nurses. Despite initial fear and inexperience under the American system, many adapted quickly, demonstrating steady hands, disciplined observation, and a capacity to follow rapid commands. The surgeons recorded that, in several instances, the nurses' intervention directly saved lives, from monitoring vital signs during critical moments to assisting in complex procedures requiring multiple pairs of skilled hands. Yet alongside these professional achievements was a profound psychological cost. Nurses spoke in later accounts of nights haunted by the faces of the wounded, the constant anxiety of operating under intense scrutiny, and the emotional dissonance of caring for soldiers from both sides of the conflict. Some nurses experienced post-traumatic stress long before the term was formally recognized. Shaking hands, sleeplessness, and flashbacks to surgical theaters were common. Even those who adapted successfully could not entirely reconcile the fear and moral tension that accompanied their role. For the American doctors, the collaboration was both practical and revealing. It demonstrated that with rapid instruction and careful supervision, even enemy personnel could perform critical medical tasks under extreme pressure. These interactions also provided insights into the German medical system, its discipline, attention to procedure, and the underlying professionalism of its nursing corps. The experience informed post-war evaluations of medical practices and influenced recommendations for international humanitarian standards in the treatment of prisoners of war. The hospital itself became a repository of stories, both harrowing and inspiring. Surgeons and nurses recorded cases in their logs. A German nurse stabilizing a bleeding soldier moments before an emergency incision. A pair of nurses managing anesthesia for hours on end. A young aide improvising to save a patient whose condition had deteriorated unexpectedly. These logs not only documented medical interventions, but also captured the psychological and ethical landscape of a war-ravaged operating room. Outside the walls of the hospital, the broader war continued to escalate toward its conclusion. The Allied advance accelerated, German resistance crumbled, and cities fell to advancing forces. Hospitals were continually relocated to follow the front lines, and medical personnel, both German and American, had to adapt to shifting environments. The nurses' experiences in Aachen and similar facilities were replicated in smaller and larger hospitals across the collapsing German territory. Each episode reinforced the lessons learned in the crucible of surgical urgency, the interplay of fear, skill, and ethical responsibility. By mid-1945, as the Third Reich collapsed, these nurses would emerge from the hospitals changed. Some returned to civilian life, carrying memories that shaped their post-war careers and personal identities. Others continued in military or medical service, applying the hard-won lessons of adaptability, cross-cultural cooperation, and crisis management. The trauma endured in those months of surgical assistance would remain, but so too would a recognition of the resilience and capability they had discovered within themselves. The immediate aftermath of these experiences was not only personal. It also influenced institutional approaches to medical collaboration, prisoner treatment, and post-war reconstruction of health services. German nurses' exposure to advanced surgical techniques, anesthesia management, and rapid response coordination contributed to a subtle but lasting evolution in European medical practice, bridging the gap between pre-war tradition and modern methodology. The broader consequences of German nurses assisting in American surgeries extended beyond individual experiences. In the chaos of late-war Germany, hospitals had become laboratories of necessity. The collaboration between Allied doctors and German nurses provided an unexpected bridge between two medical cultures shaped by very different military doctrines. American surgeons valued speed, improvisation, and decisive action, while German nurses brought meticulous discipline, methodical procedure, and a deeply ingrained sense of responsibility. The fusion of these approaches left a lasting mark on post-war medicine. Allied reports highlighted several key outcomes. First, the immediate improvement in survival rates was notable. Hospitals that integrated German nursing staff into surgical procedures could manage higher patient volumes with fewer errors. The American medical system, stretched thin by the flood of casualties, benefited from the additional hands and trained observers who could learn quickly. Second, the experience created an informal exchange of knowledge. German nurses absorbed advanced techniques, such as anesthesia protocols, blood transfusion methods, and rapid sterilization practices, which were less common in wartime Germany. These lessons would influence post-war hospital practices and nursing education across Europe. The moral and psychological consequences were equally significant. Nurses were forced to confront the human realities of war in stark, immediate terms. Witnessing the fragility of life, the randomness of injury, and the capacity for survival under extreme circumstances reshaped their understanding of their role. The act of assisting in surgery on enemy soldiers blurred the lines between national loyalty and professional duty, challenging long-held preconceptions. Many nurses later reflected that the experience had instilled a complex sense of empathy. Even amidst war, the imperative to save life transcended national allegiance. In a larger historical context, these hospital interactions highlighted the pragmatic side of warfare. Humanitarian and professional concerns could coexist with military objectives, and enemy personnel could, under strict supervision, contribute meaningfully to life-saving operations. The experience foreshadowed principles that would later inform international conventions on the treatment of prisoners of war and medical ethics in conflict zones. Hospitals were not merely logistical nodes. They were moral and educational crucibles where competence, courage, and conscience collided. At a personal level, the nurses' post-war trajectories reflected the intensity of their wartime experiences. Some returned to civilian hospitals, bringing with them a depth of practical knowledge and crisis management skills that far exceeded standard nursing training. Others transitioned into teaching roles, passing on lessons learned under extreme conditions. The psychological imprint of fear, trauma, and moral ambiguity remained, however, shaping personal narratives and professional identity for decades. For American doctors, the collaboration was a rare opportunity to test leadership, training methods, and cross-cultural adaptation under pressure. It reinforced the importance of clear communication, decisive action, and patience when working with personnel unfamiliar with specific practices. The success of these hospitals demonstrated that with careful supervision and structured responsibility, even previously adversarial personnel could be integrated into critical operational roles. By the end of the war, the lessons of these surgical theaters extended beyond medicine. They offered insights into resilience, human adaptability, and the thin line between fear and courage. German nurses had entered the operating rooms terrified and hesitant. They emerged as competent participants, capable of acting under extreme duress, and with an understanding of the shared human stakes in a world torn apart by conflict. The stage was now set for the final reflection. What these experiences meant, not only for those directly involved, but for history, medical ethics, and humanity itself. The story of German nurses assisting in American surgeries during the final months of World War II is a profound testament to human resilience and moral complexity. These women, trained to follow orders and maintain emotional composure, were thrust into situations that tested both skill and conscience. In the harsh fluorescence of field hospital operating rooms, fear and courage coexisted, and a fragile line between hesitation and decisive action became a measure of humanity itself. Their experiences illuminate the universality of duty and compassion. Nurses who had once regarded American soldiers as enemies came to understand that the imperative to save life transcended national allegiance. Each incision, each administered anesthetic, each moment of vigilance reflected a shared commitment to preserving life amidst destruction. In this, the nurse's fear transformed into a form of quiet bravery, the kind forged not on a battlefield, but in the intimate, unforgiving theater of surgery. The impact extended beyond the immediate crisis. These forced collaborations facilitated a transfer of knowledge, bridging divergent medical cultures and accelerating the modernization of post-war nursing in Europe. They also set subtle precedents for ethical conduct in wartime medicine, demonstrating that professional responsibility can coexist with complex moral and emotional challenges. Ultimately, the legacy of these experiences lies in the convergence of skill, adaptability, and empathy under extraordinary pressure. The nurse's journey through terror, moral conflict, and eventual mastery serves as a reminder that war does not merely test armies. It tests the human spirit. In the cold operating rooms of Aachen, amid blood, antiseptic, and trembling hands, history recorded more than surgical feats. It recorded courage, learning, and the enduring capacity of people to act with humanity in the most extreme circumstances. These moments, etched into memory and medical practice alike, remind us that even in the darkest chapters of human conflict, the pursuit of life and the exercise of conscience persist, shaping not only individuals, but the moral and professional frameworks of generations to come.